Hello and welcome to the Answers for Cancers podcast. Today we're going to be discussing the hormone therapy drug exemestane. We'll be taking you through what exemestane is and how it works in the body, the most common side effects associated and how you can manage these side effects, and also how to take exemestane every day. So we're going to start with what exemestane is and how it works in the body.
So exemestane is a medication used to treat breast cancer in women who normally have gone through the menopause. It belongs to a class of drugs called aromatase inhibitors. Exemestane works by blocking an enzyme called aromatase, which is responsible for producing estrogen in the body. It is often prescribed to women who have been diagnosed with hormone receptor positive breast cancer, which means that the cancer cells have receptors for the hormones estrogen and or progesterone. By reducing the amount of estrogen in the body, exemestane can slow down or stop the growth of these cancer cells.
That's great. So we might move on to some of the most common side effects associated and if there's any tips or tricks that people can use to help manage these side effects at home.
Yeah, of course. So I suppose firstly starting with one of the more problematic side effects, hot flushes. So these are a sudden feeling of warmth, often accompanied by sweating or flushing of the skin. Some tips for managing hot flushes include staying cool by wearing loose, lightweight clothing and using a fan or air conditioner to help regulate the body temperature if required. Wearing clothes made of natural fabrics such as cotton that you can remove easily, using cotton bed sheets and having layers of bedding that you can remove easily, and staying hydrated by drinking plenty of water and avoiding caffeine and alcohol, which can oftentimes worsen hot flushes. So it's important to speak to your doctor about hot flushes or other side effects that you're experiencing while taking exemestane. They can provide you with more specific advice and may be able to recommend additional treatments or medications to help manage your symptoms. So something else to touch on that you may experience are skin changes. So if you're experiencing skin changes while taking exemestane, there are several things that you can do to help manage these symptoms. So keep your skin moisturized. Dry skin is a common side effect of exemestane, so it's important to keep your skin moisturized using fragrance-free moisturizers and avoid very hot showers and baths, which can further dry out your skin. Avoid irritants such as harsh soaps, deodorants, and other products that can irritate your skin. And stick to gentle fragrance-free products. And you need to protect your skin from the sun. So exemestane can cause your skin to be more sensitive. So be sure to use a broad spectrum sun cream with an SPF of at least 30 when you go outside. So please talk to your healthcare provider if your skin changes are severe or are affecting your quality of life. They may be able to adjust your medication or recommend additional treatments to manage your symptoms. So you may experience joint pain and stiffness while taking exemestane. So exemestane can cause joint pain and stiffness, particularly in the hands, wrists and knees. Gentle exercise such as walking and swimming can help reduce joint pain and stiffness. So if you are experiencing pain, please speak to your treating team who may be able to prescribe medication to help with your pain. So fatigue may also be experienced while you're taking exemestane, and this might make it difficult to carry out daily activities. Getting enough rest is extremely important, and eating a healthy diet and staying hydrated may help manage your fatigue. There's also a podcast from the Answers for Cancers with Dr. Deirdre Connolly, who discusses how to manage your fatigue, and that is available in the practical resource section of this app. So you may experience bone thinning while taking exemestane. So exemestane can increase the risk of bone thinning, which can lead to osteoporosis. So calcium and vitamin D supplements can help maintain bone health. Please speak to your treating team before commencing any new medications. Your doctor may decide to prescribe a treatment known as biphosphonates. However, these are not suitable in every case, and your team will advise you if they feel that this is necessary for you. You might experience mood changes while taking exemestane. So exemestane can cause mood changes such as depression, anxiety, or irritability. Talking to a healthcare provider or a mental health professional may help manage these mood changes. It can often be difficult to differentiate between low mood associated with a cancer diagnosis and low mood associated with taking hormone therapy. So please do discuss it with a specialist, as they may be able to refer you for specialist supports for more support and may be able to prescribe medication if necessary. Some people experience diarrhea while taking exemestane, so it's important to stay hydrated. Diarrhea can cause dehydration, so it's very important to drink plenty of fluids, particularly water. So here are some tips and tricks that may help if you experience diarrhea. So drinking water, clear broths and other liquids can help replenish your body's fluids. Eating bland foods and low fibre food may help. Avoid spicy, fatty and high fibre foods which can aggravate diarrhoea. Over-the-counter anti-diarrheal medications such as loperamide can help slow down bowel movements and relieve diarrhoea. However, it's important to check with your doctor before taking any new medication. If your diarrhoea persists or is severe, it's important to contact your doctor for further evaluation and treatment. You may experience headaches while taking exemestane, so headaches can vary in intensity and duration and may be mild or severe. If you're experiencing headaches while taking exemestane, it's important to speak to your healthcare provider. They may be able to recommend strategies to manage your symptoms, suggest alternative treatments, or refer you for further investigations if necessary. Some people will experience constipation while taking exemestane. So if you experience constipation while taking exemestane, it's important to stay hydrated, drink plenty of fluids, especially water, to help soften your stools and make it easier to pass. Here are some other tips and tricks for constipation. So include fibre-rich foods such as fruits, vegetables and whole grains in your diet. Fibre adds bulk to your stools, making them easier to pass. Regular exercise can help stimulate your digestive system and can promote regular bowel movements. Talk to your treating team about using a stool softener, which can help make stools softer and easier to pass. In more severe cases, your doctor may recommend a laxative to help relieve your constipation. It's important to use laxatives only as directed by your doctor. And it's important to address constipation as soon as possible to prevent it becoming a more serious issue. If you experience severe abdominal pain, blood in your stools, or other concerning symptoms, seek medical attention immediately. Always discuss this with your doctor if you are concerned regarding constipation. Some people experience taste changes and a loss of appetite while taking exemestane. This medication can cause taste changes, including a metallic or bitter taste in your mouth. This can make it difficult to enjoy food and can affect your appetite. So here are a few things that you can try. Try different foods and experiment with the different flavors and textures to find foods that are more enjoyable to eat. Use spices and seasonings, as adding spices and herbs and other seasonings can help mask the unpleasant taste of food and make it more appealing. Drink plenty of water. Staying hydrated can help wash away any unpleasant tastes in your mouth. Some acidic or spicy foods may exacerbate taste changes, so avoiding them may help. If taste change is severe, talk to your doctor. They may recommend other treatments to help manage this side effect, and they may be able to refer you to a dietitian if necessary. So sometimes exemestane can alter some of your blood function tests, so we'll just touch on them quickly. So liver function should be monitored while taking exemestane. In some cases, exemestane can cause an increase in liver enzymes, which can indicate liver damage. If there is a significant increase in your liver enzymes, your doctor may reduce the dose of exemestane or stop treatment altogether. The frequency of blood tests will be decided by your treating team. So another blood test that may be affected while you're taking exemestane is your cholesterol. So cholesterol levels need to be monitored while you're taking exemestane. So exemestane can cause an increase in low density lipoproteins, also known as LDL cholesterol levels, and we refer to them as bad cholesterol, and a decrease in high density lipoproteins, also known as HDL cholesterol levels, and we often refer to these as good cholesterol. This can increase the risk of developing heart disease. It's important to monitor cholesterol levels during treatment with exemestane. Your doctor may recommend lifestyle changes such as a healthy diet and exercise to manage your cholesterol levels. And in some cases, lowering cholesterol medications may be necessary. The frequency of blood tests will be decided by your treating team. So having a diagnosis of cancer or being on cancer treatment can increase your risk of developing a blood clot. It's important to be aware of the signs and symptoms of a blood clot, as they can be serious and require prompt medical attention. So it's also important to note that a blood clot can normally appear in the arms, legs or lungs. However, you may experience blood clots in other parts of the body, but these are the most common places to experience it. So some possible signs and symptoms of a blood clot include pain, swelling or tenderness, warmth or redness, shortness of breath, chest pain or discomfort, a rapid or irregular heartbeat, and a sudden onset of severe headaches, blurred vision or dizziness. If you experience any of these symptoms, it's important to seek medical attention straight away. While blood clots are classified as serious, they can be treated with medication, so it's important to seek immediate medical attention. So you may experience vaginal dryness or bleeding. So exemestane can reduce the amount of estrogen in the body, which can lead to thinning of the vaginal tissues and decrease in natural lubrication, resulting in dryness and discomfort. Additionally, exemestane can cause vaginal bleeding when you start this treatment or change to it from another treatment. If bleeding continues for more than a few days, you need to alert your treating team. Here are some tips and tricks to manage vaginal dryness and bleeding. So use a non-hormonal based lubricant or gel during sexual activity to increase comfort and reduce irritation. Consider using a non-hormonal based vaginal moisturizer to help restore moisture to the vaginal tissues. If you are experiencing vaginal dryness and bleeding while taking exemestane, it is very important to speak to your healthcare provider to determine the cause and to discuss possible treatment options. They may be able to recommend additional strategies to manage your symptoms and make you feel more comfortable. So hair thinning may be associated with exemestane. Exemestane works by reducing the production of estrogen in the body, which can affect hair growth and lead to hair thinning. If you experience hair thinning while taking exemestane, try to be gentle when washing and brushing your hair. Use a gentle shampoo and a soft bristled brush or wide tooth comb to avoid pulling or damaging your hair. If you are concerned about hair thinning or hair loss while taking exemestane, please talk to your healthcare provider about possible treatments and strategies to help manage this side effect. There is also a podcast by the Answers for Cancers and Anne Roach in the practical section of this app, which you may find beneficial. You might experience fluid buildup, which is also known as oedema, while you're taking exemestane. So exemestane can cause a buildup of fluid known as oedema, and this can cause swelling in the legs, feet, or hands. If you experience any swelling or sudden weight gain while taking exemestane, it's important to contact your treating team right away and to let them know. So this drug may also cause a risk of infection. So leukopenia is a condition in which the body produces fewer white blood cells than normal, and this can increase your risk of an infection. If you're taking exemestane and experience symptoms such as a fever, sore throat, and other signs of infection, it's important to contact your healthcare provider immediately. They may perform a blood test to check your white cells and determine whether further action is needed. You may experience bruising or bleeding. Some people taking exemestane can report these symptoms. If you experience unusual or excessive bleeding or bruising, it's important to let your treating team know right away. So contraception. It is not recommended to get pregnant while taking exemestane, and effective contraceptions should be used during this treatment. Breastfeeding is also not recommended. So exemestane is not recommended for use during pregnancy or while breastfeeding, as it may be passed on to the nursing baby through breast milk. So just to wrap up on the side effects of exemestane, so it's important to note that not everyone will experience these side effects, and some people may experience side effects that we haven't listed here. If you are experiencing side effects from exemestane, it's important to talk to your healthcare provider, and they may be able to adjust your dose or prescribe medication to help manage your symptoms.
And finally, can we just touch off how to take exemestane every day?
Of course. So exemestane is taken by mouth as a tablet, usually once a day at the same time every day. It can be taken with or without food, but it's important to follow the instructions from your doctor or pharmacist. The dosage and duration of treatment may vary depending on the individual condition and the response to the medication. It's important to take exemestane exactly as prescribed by your doctor. Do not stop taking the medication or change the dosage without consulting your doctor. If you miss a dose, take it as soon as you remember. If it's close to the next time of your dose, skip the missed dose and continue with the regular dosing as scheduled. If nausea develops, you can try taking exemestane at nighttime. If you have any questions or concerns about taking exemestane, talk to your doctor or pharmacist. They can provide you with more information and help you manage any side effects or interactions that you are experiencing from this medication. And finally, it's just important to note that anybody can have an allergic reaction to medication at any time. So just to note, it is very